Welcome to Unfiltered Health, where we dive deep into the real stories, science, and struggles shaping modern health. Your host, Dr. Sean Hall, is an internationally recognized author, medical researcher, and lecturer. Join me as we strip away the noise and explore how chronic illnesses are impacting not just our bodies, but the very fabric of our social and human function. This isn't your typical health talk. Here, it's raw, it's real, and it's time we talk about the hard truths. Ready to rethink health? Let's get started.
Ladies and gentlemen, welcome back. And I'm sorry I had to take a small hiatus, but you know how it is. Sometimes life gets in the way, especially with the start of the year. But I'm actually thrilled to be online with you today. I have a very special friend, a colleague, an adjunct professor of psychotherapy with the University of Queensland. I'd like everyone to meet Professor Matthew Bambling. Now, quick stories. Matt and I have been around the traps a few times. We've done some really interesting, innovative research into mental health. But this is the first time we have, at least on this podcast, been able to openly talk about really what mental health is from a patient's perspective. Things, tips that they can take away with after this podcast to maybe get more out of their therapy sessions, but more so, basic information to upskill them so they are more comfortable in how they approach their clinician. Is the clinician right for them? And how they approach the therapy moving forward. Ladies and gentlemen, world, meet Professor Matthew Bambling. Matt, take it away.
Oh, thank you, Sean. It's a pleasure to be with you, and I really like what you're doing in this space.
Thanks, mate.
Yeah, well, to start off, I guess the first thing I'd like to say is that there is over 50 years of research that shows that psychological treatment works for the majority of people. And
Right.
there's a lot of caveats to that, of course. And there's been research where it's been shown to work really, really well. And then people have come and said, well, what about for the more serious end and the more resistant depression and anxiety? And researchers have gone out and done additional research looking at very, very serious presentations. And some of them even expecting to think that therapy has its limitations and maybe medications are needed. But no, therapy still worked. The caveat is that people need more ongoing treatment, even for very serious conditions like, personality disorders or serious psychiatric issues. Duration of therapy seems to become the thing that helps the most. For someone who's a bit depressed, maybe between 16 sessions, they'll do very well. With more serious presentations, people might need 20 sessions or 50 or 150. Sounds like a lot, but there's good reason to conclude that therapy is at least as effective as medication, or if not more effective for certain types of disorders and medication. Brain scans can often show very similar activation of neural centers in the brain between medication and therapy. For things like OCD, it's exactly the same. Pre and post brain scans, one had CBT, one's had medication, and the brain lights up in the same way. So counselling or psychological therapy is very neurologically active.
So in listening to what you're saying, the relationship between the patient and the provider, it's got to be key, right? And no one gets along with everyone. So let's say I'm a patient and, I have some mental illnesses. Maybe it's anxiety. Seeing a counselor might be very challenging for someone like that. What advice can you give me to sort of step out and try and identify the right person for me?
Yeah, a lot of people are discouraged. They've had a go at counselling and found it, or seeing a psychologist or a therapist, seen it regarded as unhelpful and they didn't connect with the person. I just encourage people, keep trying. When you find the right person and the synergy is there, there's some interesting things that happen. There was a study by Strathfield, who was an Australian researcher quite a few years ago, that looked at the way people's nervous systems sync up in therapy.
Wow.
And when there was a good relationship between the client and the therapist, the nervous system frequencies started to sync with each other. And some people said, well, is it just empathic moments. But no, it wasn't. When the people's brain scans, and they had people wired up, it was hysterically funny pictures, people sitting there with wires all over their heads. But when they examined, that had nothing to do with what was being talked about. It was simply an effect the therapist had on the client. And that makes sense. If a person's, got their life together as a therapist, they're empathic, they're caring, their nervous system can actually have an impact on our nervous system. There's just some people you meet, you're around and just feel better being around them. You feel calmer.
Mm-hmm.
That's the kind of thing. We're probably influencing each other in all sorts of ways all the time. So that's kind of what you want to look for, someone you kind of click with. And there's over 50 years of research that says the quality of the working relationship between the therapist and the client predicts outcome more than approach. And even in medical studies, the quality of the working relationship with the patient and their medical doctor predicts response to psychopharmacology. So it's really, really important. We can think of the working relationship much like you said. It's, do I trust this person? If we think about therapy as a car trip, we want to go on this journey together. The first question we ask is, do I want to go on the journey with this person? Do I trust this therapist enough to go on the journey with them? Mm-hmm. So you need to establish whether you like the person and you feel they're trustworthy. The second part of the journey is kind of the tasks of therapy. How are we going to share up the work? Do I understand the type of therapy I'm getting, and do I see it as being a sensible way of dealing with my problems? And that involves some conversations with the therapist. And do I understand what I need to do as a client in therapy? Sounds simple, but often these things aren't given enough attention. Do I understand what the therapy does and needs to do? Mm. So that part is, are we on the same page? Have we got the task of the car trip worked out? It's going to be a great road trip. The last part of that is the goals of therapy. Do we know where we're going? We're going the car journey together. Are we heading in the same direction? So it's really, really important that the therapist has a thorough understanding of the goals of the client. And if a client feels their therapist really gets what they're wanting to do in therapy and what their agenda for change is, you probably hit therapist jackpot.
Yeah, right. I understand that. So think about this, you've got many years experience. You've been involved in clinical trials. You're with a superb teaching hospital. As you look at the landscape for potential patients coming into this field of medicine, what are the limitations you see both from the care provider and from the patient, and where should this improvement be?
Mm-hmm. I guess in the psychological therapy world, one of the big limitations is cost and number of sessions. Medicare will fund 10 sessions.
Just hang on for a sec. To our overseas people, Medicare is a co-payment system by the Australian government. Here we have a socialised medicine platform where the government deems a standard of care for the general population and how much the government will contribute. In most cases, up until a certain point, and Matt was saying 10 sessions, the vast majority of the cost of the session is covered. That's still correct, right?
Yes, that's essentially correct. But like our overseas friends will realise too that therapy is expensive. So
yes,
mostly it might cover half the cost of a session. In previous iterations of the Medicare scheme, it was 20 sessions. Private insurance covers some sessions as well at varying levels. As cost-cutting exercises by government, the number of sessions has been reduced. Mm. So we have a system where about 40 to 50% of people, probably 10 sessions will be enough, and then people have to, that's a year people are entitled to. Then from there, there's a large proportion of people who may not be able to get further private assistance.
Yeah, right.
Their low-cost therapy options become more limited. There are some, but they're not always something people wish to pursue. And the research kind of shows that if you fund or co-support therapy up to about 50 sessions, it's actually much cheaper because the number of people who require more sessions past 10 starts to get smaller. And by the time you get to 20, that number starts to reduce down to 15%. And by the time you're up towards those who'll need 50, it's only 6 to 8% of people.
Mm-hmm.
These are people that otherwise remain ill and perhaps fall out of employment, or families will break up and all these sorts of things. So once again, it's a policy issue with governments who are interested in saving money and running programs. They're not thinking about 2, 3, 4, 6 years down the track in terms of how a lot of savings can be clawed back into the health system. Yeah,
it's funny how you say that, and I don't mean to segue. We'll swing back to improvements in the field. But when I look at it, the health policy and advocacy is a big thing of what I do. The World Health Organization has come out pretty bloody hard and said, at a minimum, 6% of the world's population has had a depressive disorder.
Yep.
At least annually, and that's only one, right? So when you look at pandemics, we just went through one.
Yep.
These numbers aren't even close. 6% of the global population, and we're talking minors and adults. We're not talking people over the age of 18 or 21 here.
I think that's right, Sean. I think major depression exceeds the rate of heart disease now, so it's a major public health issue.
So we're not doing enough, is what you're saying. Well, basically, what you're saying is we're pretty well failing our patients.
We're under-servicing that regard.
Yeah.
So of course, patients who have financial means can fund their own therapy, and that's a good thing to do. But of course, what we do about those who can't. And the other side of that is, I guess, do we have enough psychologists trained? And in the specialist programs, and I'm a clinical psychologist, once again, universities have a co-funding system with governments, and they charge fees as well as co-funding. But the numbers of clinical psychologists, for example, and other specialities like neuro and perhaps even counselling, psych and things like that, the courses are potentially getting smaller because the funding has gotten smaller. Universities often subsidise postgraduate students in this space as a service to the profession, also to support their undergraduate programs. They've got a pathway for their students. So it's a fairly ambivalent space around the training of mental health professionals. And we've got mental health nurses and doctors with interest in mental health and psychiatrists, and there's all sorts of issues in those disciplines too. It's a bit of a bottomless pit, because the broader you get and the more you offer, it will just get soaked up immediately. So there is a need to provide alternative therapeutic interventions, and whether models have been experimented with, and they all work to a point. There's possibly some of the stuff I'm seeing coming out with AI and digital interventions is looking very promising.
Yeah, wow. Okay.
Yeah.
That will appeal to the younger generation for sure.
Well, I've just have one of my last PhD students finishing off, and she developed a relapse prevention app for alcohol disorder disuse. And these are people who are hospitalised for disuse, so they had very, very significant addictions, and it's really quite a significant effect for the app-based support. And it was very clever. It did lots of things based on evidence base. Even had an online scheduled counselling stuff. You just hop on your phone and have 20 minutes with a therapist, and the effect was quite strong for that. And so things don't have to be rocket science; they can be simple. And so, I mean, it is an issue. I mean, I do understand the government dilemmas. You've only got a certain amount of money. How do you divide it up across multiple fields of comparison? But mental health is one of the issues that has an unseen economic cost. You might save a bit of money by by people not having access to these schemes, but do they become ill? Do they come into the general health system, the public system? That costs a lot of money. Do they lose their job? Well, that costs money as well.
I can safely say, especially in Europe over the last couple of years, the indirect cost of mental health is now really being mapped.
Yep.
And it's scary money. But all that aside, I take on board your experience, and I want people to understand that you are well placed in your profession, not just from a clinical experience point of view, but again, researcher, as an academic, as an author to papers. If you had carte blanche, where would you improve, or what improvements beyond AI are you really watching? What I'd like people to
Yeah.
understand is they're not in this fight alone. Some people might be geographically isolated, so the option to find a good therapist just doesn't exist.
Yeah, look, great point. I would say one of my roles, I was still am involved with the UQ Centre for Digital Health.
Oh, yeah.
The evidence for telehealth is really quite good, and access is a huge issue for people in rural and remote areas. If you have an internet connection, you can still get help. And there are some online telehealth psychological services which are bulk billing, which is really nice. It means people are thinking about the social currency and the agenda of that. So that's that's a great access people have too. The other thing I'd like to say, which I think is exciting, is the role of metabolic diets and basic health.
We should curtail this by just disclosing to everyone. Matt, myself, and a few others have spent a few years looking at this field and doing research in the area. And yes, there's some super interesting stuff in there.
There is, and one of the particularly more serious aspect of mental health, when people start to improve their fitness, lose weight, clean up their diets, it often has a significant effect on their mental health. Their resilience-based, physiological resilience, and mental resilience improves. So is some of our mental health concerns caused by our Western lifestyle? It's probably reasonable to conclude, that if we, for older males, for example, if they suffer from major depression, their risk of heart disease goes up by 65%. Often they have metabolic syndrome, insulin sensitivity. They're put on weight, their hormones are tanking. Hormones are incredibly important for our mood and our neurological health. Our brain stops secreting BDNF, so when neuroplasticity starts to tamper, we're depressed. There's good evidence that our mitochondria, which generate energy in cells, start to misfunction when we have major depression.
So you're talking about a very vicious cycle that unless you take an active profile and you work out how to break, is degenerative.
It really is, and the connection between the central and the enteric nervous system is profound. And as you well know, Sean, because we've done this research, the connection between the microbiome and, if you like, peripheral nervous system and its impact on central nervous system functioning. I mean, you can't really divide these things up into stovepipes. They're so interconnected.
So just for everyone on that, what Matt is referring to, the microbiome he's referring to, you might call the gastrointestinal tract, liver function. You might even loosely refer to it as probiotics if I follow some of the remits some marketers are pushing. But this is about the bacterium that's in your gut that either aids or abets metabolism of substances that you ingest, foods, vitamins, your protein powders, whatever it is you're taking, right? And one of the studies that we did, we did a confirmatory study on this too, was looking at certain metabolites. So these are byproducts that are produced within the body that's based on what the gut absorbs that cross that blood-brain barrier and can either create absolute havoc or can have real healing properties.
Yep. And that's absolutely correct. And one of the things that not everybody is aware of, but lots of people are, is the bacteria in the intestinal tract makes all the same neurotransmitters that your brain makes. And our intestinal tract's lined with neuroreceptors and also endocrine receptors. And it's most likely that the microbiome, as referring to in the gastrointestinal tract, is the majority of the source of neurotransmitters for the peripheral nervous system. The poor old brain doesn't have to make it for everything. It kind of looks after itself. But the vagus nerve is the main connection, and with leaky gut and other gastrointestinal issues or bacterial microbiome imbalances, vagus signaling becomes impaired, and that actually has an effect on the hippocampus. So once again, with serious depression, hippocampal volume can decrease. So people's brain tissue starts to alter, and so it was said by, I think, Socrates that the fallacy of physicians of his day were to try to separate the mind from the body. And that was thousands of years ago, and not much has changed. Yeah.
You know, I can remember my first week in medicine. I don't think I've actually shared this story with you. I had a professor get on his soapbox, and he was doing the ooh-rah-rah, but he ended the lecture with this. He said, if there's one thing I'm going to teach you, and he goes, it won't be in the exam. Win the mind, the body will follow. He said, never forget that. And here we are, we're talking exactly this point.
Absolutely. And, hopefully in medicine there'll be a continued push towards integration and a holistic view of our health. And that's one of the reasons I'm really keen with my patients to look at their general health as well. What is their diet like? Are they doing enough exercise? And if we think about the pillars, if people are eating well, they're not a junk food diet, they're not eating high glycemic carbs, they're not spiking their blood sugar and insulin continuously and causing inflammation in their gut and causing inflammation in their brain and body, and nothing damages the endothelium of the arterial system like high elevated glucose and masses of insulin being pumped out in response to it.
Yeah, right.
So if we can get diet right, and are we doing some exercise? Are we sleeping? Are we getting enough sleep? And who gets enough sleep? But that's worth working on. What's work-life balance like? How are our relationships? If we just get those four things lined up, where we can, got a heck of a base for not just getting through our issues, but coming out stronger and thriving. So that's often something we look at as well, in addition to the psychological work. There's another procedure I use a lot called EMDR. It's a neurological procedure that involves hemispheric switching cognitive load, and use it a lot in trauma and people who are stuck with issues who can't shift, chronic anxiety, and it's remarkably effective for desensitizing people to what's upsetting them. And also it seems to have the capacity to kind of force the brain to process the issue. We often feel with things we're stuck with, whether it be traumatic or worries, that it's right in front of our face. We can't shift that. We're always thinking about it. And EMDR has a capacity to put it in the rear vision mirror. It goes back up into the bookshelf again. We can take it out and look at it if we want to, but it's not something that's bothering us. So there's kind of some groovy techniques, and there are other things too. There's hypnosis and biofeedback and all sorts of things. But when so little is new in mental health, EMDR has been one of these things in recent decades, which is very new and very effective, and has been making just a hell of a splash in practice around the world, and is certainly worth pursuing too if people find they're really stuck with stuff. So the other side of nutrition too is in more serious presentations of mental health. We have things like bipolar disorder and schizophrenia. One thing, this is anecdotal, and there are people in the US who I'm in touch with who have actually started metabolic clinics treating mental health this way, and it's something for people to take with a grain of salt. It may not suit you, but I have seen really good results with very, very serious presentations, eating disorders, with overlaying of bipolar or schizophrenia, is restricting carbohydrates and increasing fat. So it doesn't mean people have to do a ketogenic diet, although I probably think if people are that ill, what the heck have they got to lose? It's worth doing it for 3 months to try it. I've seen remarkable symptom improvement. The medications work better. They feel more level. There are some theories that some psychiatric illness, it represents damaged carb metabolism in the brain as part of it. There's pro-inflammatory states in these conditions. In a ketogenic diet, the brain's burning ketones primarily, so it's burning fat bodies. There's an old myth that our brain prefers carb. It doesn't. It'll use whatever's there. It's very happy on ketones as well. And people often find their mental energy's better, their mood's more stable, they're not getting tired, no brain fog. And that's something too, which, with a practitioner, you can try it yourself, but,
we actually have a family friend, I won't mention any names, and she has a condition. I won't get too deep into it, but she has to be on a keto diet to manage the manifestation of that condition.
Yep. It's extraordinary how well it can work. I have people may be aware that before there was epileptic medication, people were treated with ketogenic diets, particularly children. And the research showed Yeah, and the research shows the ketogenic diets were just as effective as medication in managing childhood epilepsy. So it's a powerful metabolic diet. There is really good evidence that mitochondrial function, remember our energy organelles and our cells, improve on a ketogenic diet. We make more of them. They last longer, they function better. So there is something quite profoundly metabolic about this kind of eating. Yeah.
What might be helpful to the listeners is I'm a proponent of ketogenic diets, but the fallbacks that I commonly see is getting a person into ketosis.
Yep.
And then there's a rather strict requirement in keeping them because it's easy to come out. And there is so much junk on the internet about these kind of diets. Do you have any words of wisdom? Because it's you've got to do some homework on this one before you jump into it. Right?
Oh, couldn't agree more. Research it, decide whether it's for you. There's a lot of junk information about ketogenic diets. There are some really good people on the internet. Even being keto, there's a whole market now in keto snacks and fat bombs and things. A lot of those are not healthy at all. You're better off making keto desserts from scratch. Get a YouTube recipe and do it if you must have a dessert. It is hard. I mean, if people have had a lifetime carb addiction, it's a little rugged, and I know because I've done it myself. And but after a few weeks, I remember making loads of keto desserts for the first 3 months, and then my desire for it just kind of died. I'm not that interested in sweets now. If I really want something nice, I'll have a sugar-free kombucha or something as a little treat. But it does. You may go through a difficult fat adaptation. Some people can feel a little unwell. That's usually an electrolyte issue. People taking their minerals and electrolytes, they feel a lot better. But when your body adapts from 2 weeks, and the full adaptation is about 3 months, you'll be firing on all cylinders. And if you doubt whether you're disciplined enough to stick to a ketogenic diet, I might add that can be very, very diet. There's not much you can't replicate in a ketogenic diet that you could have outside of a ketogenic diet, but it is no to a few things. But if you feel that gee, I lack the self-discipline, work with somebody who does this. And,
it's actually really good.
Yeah, get the encouragement, and they'll help you. I mean, I've done that with my patients as well. And but it's important to be interested. It's not something I recommend to people unless they're interested in doing so, because unless people are keen to do it, they're unlikely to do it, because it's a big change to their life and their eating patterns.
You have compliance issues.
I've yet to have someone who's done it tell me, gee, that was a waste. I got no benefit out of that. Most people are pleased and they stick with it. I've had people say to me, I went off my diet when I went overseas. I'm back now. I can't wait to get back on it. My mental health symptoms flaring up again. I was noticing the old pull back towards destructive behaviour, and I don't feel as good. And I'm day one, I'm back on the diet. So I don't want to overplay that, but it's another tool. We're talking about, Sean, I've been talking about levers. You've got psychotherapy and counselling, which is very effective. Then maybe looking at things like the microbiome, or other, then our health behaviours. We're doing exercise, and then we've got another metabolic living pool with diet. And, we can improve our sleep. That helps too. So with more serious end of mental health problems, which are more resistant to treatment, much better to have poly lifestyle and nutritional interventions than a polypharmacy interventions. We have poor people who are on antidepressants and antipsychotics, and this cocktail of drugs where it works to a point, but the side effect profile is diabolical and they really struggle. And this is the other side of that as well, that the types that we're proposing, relatively side effect free. Now, there is a place for pharmacology, certainly across all cases. And for depression, for example, antidepressants work well for about 30% of people. And that's a great outcome in mental health, because so little really works in mental health. Another 30% will get some degree of improvement. They'll notice some sort of improvement. The remaining 40% will either get no improvement or get much worse on antidepressant medication. So we're seeing, while it certainly has a place, it's not going to work well for everybody. if you've had one episode of depression, you've got a 50% chance of a second episode. If you have two episodes, you've got a 70% chance of a third. If you have 3 episodes, you've got a 90% chance of having more episodes. Once you've had 3 sessions and you get your 4th and 5th episodes of depression, you're kind of in that treatment-resistant depression category. We've kind of walked up the ladder, and we're kind of getting that territory that's showing that what's been offered hasn't really been working very well. So people who have repeated episodes of depression, might be prime candidates for looking at some of the lifestyle stuff and other things. And in conjunction with your medico or your psychiatrist or psychologist, I always say to my patients, well, what the heck have we got to lose? Nothing ventured, nothing gained. If it doesn't work, we'll move on and do something else. And I think keep a curious, open mind about possibilities. But, we don't want to become zealots where we're spending all our time looking for alternative approaches. I am a bit dubious about people who say just take this supplement and all your problems will go away. In supplementations, very little works. Number one, because if they do have a pharmacological effect, they're not very potent. They have to be concentrated and synthesized into a drug. Yeah.
Not to steal the show, but my concern on the vast majority of supplements in the marketplace is there's not one shred of efficacy work actually done on that supplement.
Yep.
Most of these guys like to stand on the shoulders of someone else, and it grates me, right?
Yep.
But that's a whole topic for another day.
It is. It's an important topic. We know, for example, St. John's wort is a weak MAO inhibitor, which has a mechanism of action, but very little research has been done on. There's been a couple of studies, and it's helpful. SEME, for example, S-adenosylmethionine, is also helpful. It's a great, assists with the methylation pathways and improves DNA expression, the mitochondria, does lots of different things, anti-inflammatory, but there just isn't and those things may indeed be useful, but I'd say not a lot else. Some modest, fish oil might be useful to some degree for some people. We need omega-3s, but it's not a panacea. So little is, and probiotics, while they can be very useful, it's certainly another lever we can pull. For a lot of people, won't be enough to improve things. Might get a bit of an improvement, but it won't be sufficient to solve the problem. And once again, things like metformin's been shown to improve mental health generally, and interesting enough, its mechanism is to sensitize cells and improve glucose metabolism. So once again, we've got that link with metabolism. Metformin also stimulates mitochondrial biogenesis. I think, I haven't seen research to prove this, but I think it's very likely that it also supports neuroplasticity as well, and maybe a BDNF stimulator. The drug amoxicillin was a failed antidepressant that's used to treat ADD for people who can't tolerate stimulants. One of its main actions is a potent stimulator of brain-derived neurotropic factor. The same thing tends to happen with dexamphetamines and things like that. There's a study done recently which showed that for people who are on ADD medication, they had less brain atrophy with age and better executive functioning and memory than people who weren't on ADD medication. And is that a function of does ADD protect you from that? Probably not. It's probably the medication. So there are certain things that do help, and people find it improves their mood. And people I've referred for ADD assessment who are suffering from anxiety and depression and struggling with life, put on ADD medication and they feel so much better. They can have sustained focus and they're no longer impulsive. They can communicate with their significant others properly. They're not feeling overwhelmed, and their depression and anxiety goes away. Score. But probably not everyone, but all these things have a place.
Listen, Matt, I hate to do this. We're almost out of time. I think we could sit on here all day and chit-chat away. Is there any lasting words, any quick summary you want to give people who are out there going, I need to step forward. I don't know how. I don't know what to do. I don't like the guy I'm seeing, or whatever it may be. What helpful hint would you give them?
Look, I think if you're struggling with your practitioner, talk to them about it. And if you're not wanting to upset them, think about it as, unless you tell them that you're not happy with the service you're receiving, they've got no chance of doing anything different to try to meet your expectations. If they don't do that, you need to find another practitioner.
Yeah.
The other side too, I'd say, is if you're suffering, if you have mental health issues and you're thinking, well, should I or shouldn't I get help? Get help. The research is on your side. It's going to be useful, whether that's for your own mental health. It could be a relationship problem, a conflicted, unhappy relationship. There's good research that says coupled counselling for the majority of people does help. There's just so much to be gained from it. And the earlier we get assistance, often the easier things are to fix. When things have been going for years and they're ingrained and people have had systemic multiple traumas and ongoing negative experiences in relation to their problems, there can be a lot more work to do. So that's a thought I'd leave people with, that, by and large, it's a friendly profession and we're good to talk to, and we're interested in your well-being.
Mate, that's excellent. Thank you very much. Ladies and gentlemen, I really hope you've enjoyed this. Mental health is a huge topic, and the way I view it, it's not just one of the many chronic illnesses that we front today. It's a multifaceted illness. You've heard Matt mention a couple of times the correlation between heart disease and mental health. If you've listened closely, you've also heard things like obesity. I can factor in there other things, gut dysfunction, liver dysfunction. But what I do want you to take away, if left unchecked, this is a degenerative condition, which means time's not on your side and it will get worse. Our numbers globally are beyond repute, right? And from a public health point of view, I personally don't believe we are doing enough. It is a huge topic. It doesn't discriminate between age, sex, religion, or location. We're all in the same fight. Matt's advice is good. If you're thinking about getting help, don't think, do. And that's a hard thing to do. The first step is always the hardest. Ladies and gentlemen, my name is Dr. Sean Hall. With me today is Professor Matthew Bambling. It has been wonderful having you with us today, and I really do hope, especially in this topic, this has been useful to you. Until next time, take care. Bye-bye.
Thank you, Sean. Bye-bye.
Cheers, mate.
Thanks for tuning in to Unfiltered Health. I hope today's episode gave you something to think about, because understanding our health means understanding our world. If you enjoyed this conversation, make sure to hit that subscribe button so you never miss an episode. And don't forget to share Unfiltered Health with your friends, family, and anyone who cares about getting to the truth behind chronic illnesses and their impact on society. Together, we can break the silence and create a healthier future. See you next time.